Hello, everybody, and welcome to another webinar here from MiguelStanley.com. I decided to put on a tie here today. So I wanted to thank you all for joining me here, and I'm going to keep this one pretty short and pretty sweet. I think there's an overwhelming amount of webinars that are going on around the world today, and I really am. There's so much good content online right now, so I really don't want to bore you with too much content. So I'm going to try and keep this under 30 minutes, and just give you a very brief outline of what slow dentistry is and how it can help you to improve your business and your practice. I have Dr. Katerina on my team. She's here in my earpiece. And if there are any good questions during this webinar, please write them in the question box, and I will interrupt the presentation to answer any questions. So please say who you are, where you're from, and I want to try and make this as interactive as possible so that everybody can have a chance to ask questions and interact, okay? So again, thank you all for participating and taking some time out of your day. COVID-19, my God, who would have thought this would take on the dimensions it has? I just had an article come out today in the Dental Tribune International. So we'll be sharing that on MiguelStanley.com in the next few minutes. I think it's probably already up. I want to thank Natalie from the editor from the Dental Tribune International for that. I answered a few questions on how the COVID-19 is affecting me, my business, and my thoughts on the industry in general. And yeah, everybody's scared. Everybody's worried. Nobody really has any answers. We've been chatting with a bunch of dentists, good friends from all over the world, from Singapore to Hong Kong, China, Latin America, Brazil, the US. Everybody's in the same boat. So the bad news is we don't really know where this is going. The good news is we're in this together. And, you know, I always try and be as positive as I can using any of my platforms to inspire people to, you know, be part of a bigger game. You all know I have that hashtag, but also it's in times like this that awesome things happen and truly incredible things, people coming together, you know, knocking down barriers, new frontiers being opened. And I really think that some really exciting, amazing things are going to come out of this. I don't know what, I don't know from where, but we're all seeing that. So don't lose sight of hope. Don't ever think for 1 second that you're alone in this. We're all in this together. But one thing's for certain, the way that we were practicing dentistry in the past is finished. There's going to have to be a new way that we practice dentistry. Now, a little bit of context here before I start and before I jump into my presentation here on Slow Dentistry. And again, I'm going to keep this very simple. See that this is a poster. It's not the real deal, but that's a Keith Haring painting. Now, Keith Haring, as you know, big fan. He died of HIV/AIDS in the AIDS epidemic in the late 80s and early 90s. And I'm 47 years old. When I went into dental school in 1992, AIDS was a big thing. There was absolutely no cure. And, you know, we knew from our teachers that aerosols and the possibility of you catching HIV from, you know, pricking yourself with a needle or getting blood in your eye or something like that was a reality. So I was born as a dentist, somebody with an absolute acute fear of HIV/AIDS. Moreover, hepatitis C and every other thing that you can imagine. Now, as you all know, in a recent post, I mean, any dentist watching this, and I also invite non-dentists to watch this because slow dentistry is actually built for the general public. This is something that we are actively pursuing, is promoting our 4 basic cornerstones to the general public. And I'll be talking about this later throughout my interview. So I've always known, as just as the New York Times came out with, that dentistry was a high-risk profession. We know it's a high risk on several levels. I mean, how many people looking at this photograph don't instantly recognize their jobs as a dentist? We're this guy with that mask, and we're carrying all of this stuff on our back. Now, that can be our team, our patients, the decision-making processes that we have to make, the risk of cross-contamination, getting infected from something, hurting ourselves, making a wrong judgment on a diagnosis, misdiagnosis. It's so stressful. There's a bunch of people. I gave a webinar with Simon Chard that will also be up on my channel, miguelstanley.com, on mental health and how, you know, the stress of dentistry can relate to mental health as well. A lot of mental health issues. My friend Kyle Stanley out from California as well, always bringing this important topic to the general public. We have a very stressful job. And it can, you know, I think a lot of dentists are their own worst enemies. Why? Because they tend to overload themselves with work and haven't really established a healthy ecosystem around themselves to have that team support. I'm very lucky at the White Clinic because I have an awesome team, but let's be very clear, that team is incredibly expensive. And at times like this, even more expensive. But you know what? You have to try and figure out, and this lecture isn't about just that aspect of practice management. And I really want to keep this simple because we can go down many rabbit holes discussing business management. But if you are that kind of dentist that, well, I'm going to do everything by myself, I'm not going to have partners because I want to keep all the profit to myself. Well, then again, all the stress is yours, all the profit, yes, but all the stress and all the anxiety and all the risk. And again, the risk of cross-contamination. And when you're working by yourself in a stressful environment like that, what's going to be happening? You're going to be seeing more patients. You're going to sooner or later make some form of a mistake. Now, I'm not going to get into my CV and any of that, but I've traveled extensively around the world. I've lectured in well over 50 countries, many times more than once. And, you know, let's face it, dentistry is very demographic. And, you know, I live in a first world country, in a developed country, and I've also been to some incredible clinics. I visited my friend Tom Mutyabali's clinic in Uganda with Dr. Katerina Online in Kampala, and you know the guy had technology there that some of the best clinics I've seen in Europe don't even have. So you can always be very, very surprised by you know, people and clinics in the most remote regions of the world. And there's something as dentists that connects us all. What is that? We all treat people. So we practice dentistry, check. People come to us for a whole different array of problems, and we have tools that we can fix that. Now, maybe we have, you know, different degrees of experience. We have different materials. We have different technologies. And I'll be talking, I believe, next week on how technologies are driving change in new materials. I'm a very passionate advocate for new technologies. I am the vice president of the Digital Dentistry Society, after all, and I'm very passionate about that. But there's so many things that we have in common as practitioners, even if you're by yourself in a team, if you're in a first world country or in an underdeveloped country, if you're at the beginning of your career or if you're at later stages of your career, there's so many things that we have in common. But then there's also a lot of things that we don't have in common that separate us. And we could sit here in our heads and start doing a mental checklist of all the things that we have in common, right? And it's those things in common that we have that the general public perceive is dentistry. So, you know, a dentist has a dental chair, he puts on gloves, he has a mirror, he has a drilling machine. And try and think of dentistry now for the rest of this conversation from the public's perception, not from your perception as a dentist. How does a general public see the clinic? Now, their greatest fears are usually pain, cost, clinical results, And that was already so difficult for us to all manage. And now there's going to be a fourth level of fear from our patients. And that's going to be, am I going to get sick at the dentist? Because, thanks to that article in the New York Times, it's now become very evident that dental clinics are a source of cross-contamination due to aerosols. And they slowly realized, oh my God, I can get sick at the dentist. Now, we all know and praying that this COVID virus passes, and it passes very soon, and hopefully we can develop a vaccine, and hopefully we can create immunity, and I'm praying for that to happen, and I'm sure you guys are too as well. But what about the next time? I mean, knock on wood, I don't want that to happen, but I don't think that people's brains are going to adapt that fast and just go back to normal. And I think people are going to demand at a dental clinic certain measures are taken, and that will happen in the best practice in the most, civilized country in the world, and it will also happen in countries that are in underdeveloped cities. So now we have this extra layer of difficulty in our practices, and much like this image that's in the screen, we've already had a tough job. We already have a stressful job. Just until last month, most of us were fighting competition and trying to figure out how to be better and how to boost our revenues and lower our costs and grow and expand and sell better. And we already had this stress enough. Now we've got this one to deal with. So I wanted to talk a little bit about that. And if you think about this just from a patient's perspective, there's absolutely no police in dentistry. Nobody's policing your work. And now this slide was made quite a few years ago. And if you think about it, the only way that the general public had to control the quality of your dentistry was I treated on time? Because usually patients complain if you're late. Did it hurt? Was I comfortable during the treatment? Was my doctor nice to me? Did I pay a fair price for this? And that's pretty much it. That's most of the comments you'll get on your Google, on your Yelp, whatever, are pretty much these very basic things. How a patient feels about their treatment. They don't understand the complexities of the science, of your judgment, of the meticulous adaptation, the quality of your implant, the quality of this or that. And so at the end of the day, it's up to a doctor's ethics and the patient's level of information or ignorance that would create this, ideal scenario or a perfect storm. So if you have a very unethical doctor with a patient that's absolutely, not that clever, not informed, you have a disaster, a recipe for disaster, which is, and you've seen this, and everybody knows what I'm talking about, those clinics that see 30, 40 patients a day. And, the guys, I saw 50 patients today. I'm amazing. High five. And now we know that high five is probably highly contaminated with virus and bacteria. So I'm not happy at all that this COVID outbreak has happened, and it's going to affect the lives of thousands, if not hundreds of thousands of people in our profession. But there's got to be a silver lining here. And that silver lining is it's time now to go slow. It's time to really control the way that we practice dentistry. So in 2010, I registered slowdentistry.com. Just to be very clear, already a decade ago. I didn't really know what I wanted to do with it. I didn't really know what it was going to be. But I knew that I like cooking, and I wanted people to understand that, if you make a pasta sauce and you let it cook for a few hours, it's always tastier, and sometimes even tastier the next day, than if you do it in a rush. And I always understood that going slow and taking your time was so much better. Now, a lot of you will also be thinking about, but you talk about digital dentistry and how it speeds things up. I get that question a lot. So very quickly, in a kitchen, if you are cooking that pasta sauce, if you have a very sharp knife, you can cut your carrot a lot faster. If you have a pressure cooker, you can cook it a lot faster. There's a lot of tools you can have that speed things up, but it's not going to eliminate the fact that if you let things take time, the overall quality is better. So after a lot of thinking and criticism and discussing with colleagues and being my own best critic or worst critic, I kind of understood that there are 4 cornerstones that you can't really argue with if you are in Uganda, if you are in the poorest, I'm not going to say Uganda, but if you are in a very poor country in a very poor remote part of the world versus, even an upper end in New York City or London or Paris, that 4 things that if you are doing them, you are inevitably giving your patient better service. So Slow Dentistry was born out of that. So I'm going to show you a few videos if you haven't been to the website already and let you figure it out for yourself.
Are you looking for a new dentist? You need a filling or a new smile? Choosing a dentist can always be a difficult experience. But now there is Slow Dentistry. A Slow Dentistry clinic is different than a regular clinic. Why? Because the minimum time for an appointment at a Slow Dentistry clinic is 1 hour. Our dentists make sure that in between appointments, the treatment room is correctly disinfected so that you don't get any illnesses from the previous patient. They will also take all the time it requires to let the anesthetic take its full effect. They will always explain each step of the procedure and give you a signed valid consent form, and always use a rubber dam for root canal therapy and most of the filling. Slow Dentistry not only does great dentistry, it also protects the patient to make a trip to the dentist a wonderful experience.
So if you visit slowdentistry.com, these videos are on there, and they explain that, what's the difference between a Slow Dentistry clinic and other ones. I'm going to show you a few more. Here we go.
Do you wash your hands before you sit down for a meal? The reason behind this is cross-contamination. Bacteria that you picked up throughout the day could really make you sick if you don't wash your hands. The same principle applies at a trip to the dentist. Studies show that it takes up to 10 minutes or more to disinfect the dental chair and the room in between appointments. A Slow Dentistry clinic will make sure that the dentist and his team wash, clean, and disinfect the entire room, chair, and all of the instruments in between appointments so that you don't get sick. Safety is a priority at a Slow Dentistry clinic near you.
And another one.
Did you know that a proper, informed, valid consent about risks and rewards of each dental intervention should be given to you, the patient, before you start each treatment on the trip to the dentist? Your dentist can sit down with you and explain step by step what is going to happen during your dental treatment, from simple to a complex intervention. This should always happen. It's like turning the light on in the dark, so you feel more comfortable with your surroundings. This helps make sure that a trip to the dentist is a more relaxing and pleasurable experience. Look for a Slow Dentistry clinic near you and relax.
One more.
In the past, a trip to the dentist was a very painful experience. Barbers used to pull out your teeth without any anesthetic. Can you imagine how painful that was? Throughout time, dentists have come up with many ways to make sure that you don't feel a thing. But only in the past 100 years has dental anesthesia been used effectively in a trip to the dentist. Still today, many dentists don't wait enough time to let the anesthetic kick in fully so your treatment is pain-free. At a Slow Dentistry clinic, your dentist will ensure that he takes all the time required to make sure that the anesthetic takes its full effect before starting your treatment. So a trip to the dentist is a pain-free experience.
And the last one.
Do you know what a dental dam is? A dental dam, or rubber dam, was invented in 1864 by Stanley, and it is considered one of the most essential elements in safe gold standard dentistry today. It is a square sheet made of latex or nitrile that is used to isolate one or many teeth that will be treated by your dentist. It is very important for root canal treatments and for most of your fillings. The objective of a rubber dam is to stop your own saliva, which contains bacteria and that is also wet, to not contaminate the surface or the canal that your dentist is treating. This will help ensure longevity and a safe treatment and stops you from swallowing any nasty products your dentist may be applying to treat your tooth. And in case you drop the file, it can stop you from swallowing this dangerous instrument. It protects you, your teeth, and your dentist against any harm.
All right. So as you've understood there, what these videos show is that we're keeping it very, very simple. A lot of people reach out to me and say, well, how do we apply to this and that? And haven't you thought about this? And haven't you thought about that? Well, we actually have quite a few amazing global honorary ambassadors that we have been talking with for quite some time now. And there's a lot of ways that this can go. There's a lot of areas that we can develop, and we have a lot of things in the background that are going to be happening in the next months and in the following years. But for now, Slow Dentistry, we're trying to keep it very, very simple and help the general public understand that a slow dentistry practitioner is somebody that really respects these four cornerstones. So as I said, I'm sharing my screen with you today. We're going to sign up here to slowdentistry.com, and there we go. And I'm going to take you to the homepage of the website. Okay? So this website will explain everything about slow dentistry. We also currently actively ask people to share this with their patients and with the consumers. So you can go on here. We have an area for the practitioner and for the patient. So if I click on here for the patient, that will go in and then explain. We can get feedback from the consumer, testimonials. So a patient can say, "Oh, I went to a doctor and he did a root canal and he didn't use a rubber dam. I was told that I would have a rubber dam to do a root canal, or I went to the clinic and he didn't wait till the anesthetic took full effect and I had pain." These very simple things that the general public can understand, because they don't understand the complexities of dental care. They don't understand that. These things they can see, right? Because they can feel it. So if a patient's in the waiting room and he's seeing patients coming in every 5 minutes, he's like, hang on, how are they disinfecting? How are they even washing their hands properly? So we're trying to keep it really, really simple and help identify practitioners and clinics that are actually going that extra mile, and I'll get into that in a bit. So then there's an area for the practitioner with all the benefits and our network, patient awareness, et cetera, et cetera. And if you're thinking of becoming a member, just today, as we speak today, this page has changed. And if you fill out here your email, your phone, you can choose what country you're in. Here I can put in Portugal. I'll fill it out like that, and you can put in your phone number, your city, your country, and how you heard about us, and you submit that. You'll receive an instant email with a password that will give you access to the member lounge. And in that member lounge, you can choose if you are a single practitioner. So like, for example, you can click here, I'm a professional individual, or you can choose I represent a clinic, or, there's different areas that you can select here. So we have also now just opened this to young dentists, in their first 3 years, to dental hygienists. We're also going to be working with dental labs, lab technicians as well, because we believe that, and we've got one of our honorary ambassadors, Milos from Romania, because we're working on also improving how dental labs are delivering work to dental clinics and how dental clinics are delivering that work to dental labs to try and mitigate and lower the risk of cross-contamination, which of course we all know is super, super important. So it's really, really easy. We've made it, again, due to the COVID virus, it's a paid membership, of course, and we've dropped the prices radically so we can get more people on this platform, so we can make more noise and use these revenues also to promote and to market this consistently to the general public. So it's almost like a certification, let's say, of yourself or your practice. Because I just a little side note here, I get doctors calling me and saying, "Oh, I want to practice slow dentistry, but my boss doesn't allow me to." And my answer is very simple. If you can't convince your boss that putting on a rubber dam to do a root canal or a restoration is in his best interest, if you can't convince that, you got to quit. You got to quit, and you go get another job. Because as long as dentists are accepting to work in clinics that don't allow them to have enough time to think, to wash their hands, to disinfect, to practice these 4 basic cornerstones, to talk to their patients, this will never get better. So becoming a slow dentistry clinic or dentist or dental practitioner or hygienist, this is going to give you an extra, let's say, badge or an umbrella under which to argue your points to your boss, to your friends, to your network. So, just explaining that, I'm a certified slow dentistry person because I believe in these 4 cornerstones. And we've actually had a tough time promoting this, and I'll get into that in a little bit. You'd think that everybody would say, oh, fine, because who can argue with assigned valid consent, giving your patient assigned valid consent before starting a treatment? I'm going to take out a tooth. That tooth could that socket could infect afterwards, and you might need to take antibiotics, and you might suffer from pain and from swelling. I think you have a duty to inform that, but then the patient might ask some questions, and you have to answer those questions. And then they say, but what if? You have to have time to talk to your patient. I'm going to place a dental implant, and that implant could not integrate in the first 6 weeks. And then we're going to have to go through a second stage surgery and bone grafting and all of the costs to repeat that and to fix it. Who's going to pay for that when it goes wrong? Who's going to fix these things? It takes hours to explain this. And the bigger the case, the bigger the complexity, the bigger the signed valid consent. And you can't do these things in a rush. So signed valid consent, who can argue with that? If you are in a clinic that obliges you to see 30, 40 patients a day, you can't talk to your patients. So get on that one. The second one, as we saw, is the use of a rubber dam when you're doing root canal treatments. So why is that so important? We're all dentists, and if you're not a dentist watching this, a rubber dam is essential, as you saw in that video, for so many things, but it improves the quality of restorative dentistry, and it avoids you swallowing. It improves things exponentially. Yet if you go around and ask patients what a rubber dam is, most of them have never seen it. And you start asking, now I understand why that dentist charges 30% less than I do for a filling. Why? Because he's doing it by himself. He doesn't have an assistant with a high-speed saliva or surgical aspirator to reduce aerosols. That's one. And they're not using a rubber dam, so they're saving time. They can see twice as many patients a day, and that's how they can reduce costs. So rubber dam, who's going to argue that? Anybody that wants to argue that a rubber dam isn't essential for most restorative dental work and all root canal treatments, feel free to get in touch with me and we can have this debate online. Third one, disinfection in between appointments. I mean, are you really going to argue that now? Because I'm going to talk a little bit about that. So as you can see here on the news segment, we had a slow dentistry event in November in London. And I really want to say thank you to all of the ambassadors that came and spoke. We had people flying in for this. And we actually got a lot of news. And I'm going to click on this link. And we got, in the Daily Telegraph, we got a mention here. Slow Dentist says it's better to be patient in the chair. So we got, the Daily Telegraph talking about that, which was fantastic. What else did we get here? We got the Dental Review, Slow Dentistry, give dentists the time they need. So we did a lot of work, and I want to thank Tracy Posner for helping us get this message out there. And again, all of the ambassadors. And feel free to go and read all of this, again, here on the news segment of the website. Follow us on Facebook, on Instagram, and on LinkedIn. But here's the deal. So here we are giving our lectures to about 200 people in London. These are the ambassadors that were there. So, and also we're very grateful to Voco for sponsoring this event. Voco, as you know, is a company that makes composite. And they manufacture this in Germany, and the Germans do everything correctly and properly. And, you're trying to explain to them that most dentists in the world don't put a rubber dam on to do a direct restoration. They're like, how is this possible? So I think it's really important that, we all come together, that companies are going to be associated to slow dentistry because they understand that dentists that practice slow dentistry, hygienists that practice slow dentistry, dental technicians that practice slow dentistry are going to respect their materials, their technology, and their products a lot better. But anyway, after we gave our meeting, people were coming up to us and saying, it's really nice, but I don't see how it's going to be practical to take 10 minutes to disinfect a treatment room in between appointments. It's just not practical. I just can't do it. On the NHS, the average time for an appointment is 15 minutes. So I'm like pulling my hair out. I'm like, but how can you not be listening to me? And, then we have the opposite. We have a lot of guys coming up to us and saying, we've been practicing slow dentistry, but we're fully private. We charge a little premium for that. And so it starts seeing that there's like almost two sides of dentistry. There's the one that's focused on volume and numbers and profit, and they do a great service. Please don't get me wrong. The people that can't afford expensive quality dentistry always have to find some form of a solution. But should it be at the risk of cross-contamination? I don't know. Well, I definitely do. No is the answer. So this was November. This is what, 4 or 5 months ago. We were getting criticism that 10 minutes was way too long to disinfect in between appointments. We even got a segment on Sky News, and Sky News were like, they showed the news, and then the commentators were like, oh my God, now they want us to spend an hour at the dentist. Oh, we don't want to spend that long at the dentist. And I don't think that anybody's really laughing now, because the whole world is talking about the importance of cross-contamination, washing your hands, correctly disinfecting all surfaces. So, the time is incredibly important. We've been talking about this now for 15 years. Also, we have a segment here where you can find clinics on the map. So we have a geolocator for clinics that anybody that signs up their clinic will instantly be popped onto their geolocator, and they can put that on their website. So, they can tell their patients, look, we're going the extra mile. Because I think that on the outset, once we come out of the cycle of COVID and we slowly go back to work, I'm sure you're all wondering, can I charge the same fee? Well, I actually think it's not acceptable that you charge more to see your patients. I really don't think that's acceptable. But it's okay to charge more in general. Why? Because if you're going to be taking all of that time to protect yourself, to wear as proper clothing, the mask, the hat, the goggles, that extra time should be paid for. So much like a lawyer, and Corey Ferran, my friend and ambassador from the UK, you can see all of our global ambassadors here. Some of the top dentists in the world are here, and I'm sure there's room for many more. But Dr. Corey Ferran, he was talking about lawyers. So a lawyer isn't paid really to do any physical labor. They're paid to think, and they're paid to give their ideas and their thoughts. And they actually, if you have a phone call with a lawyer, they'll put a timer on, and you're charged for that time. So should us dentists shouldn't we be allowed to charge for that extra time it takes to properly disinfect in between appointments? I personally think we should. I don't think there should be a timer on it. I just think that if you are a slow dentistry practice, it's just part of the ethos of your clinic that you are seeing fewer patients a day. You're investing in all of these extra layers of security, and so it's legitimate that you charge more. And if a patient doesn't feel comfortable with that, then quite frankly, I think that there's going to be other clinics that are more than happy to risk their lives, the lives of their patients, and the lives of their team by cutting corners when it comes to safety. I think times have changed. So I did tell you that I wasn't going to take too long on this presentation. So on the news, there's some articles here, but we just put this on right now today. There's a PDF here, and it's free for everybody to download. Again, I want to thank a lot of our ambassadors for helping us work on this. So we've created 10 simple steps to fight cross-contamination in the dental practice. And if you can just read through this, so we've got regularly clean floors and surfaces, the hand washing, clean zones within the clinic that other people can't access, The disinfection of delivery packages and, such as lab work, dental work. And then here on 5, the correct disinfection of the treatment room. Some rules for the reception. In some countries, everybody likes to give a kiss. I think that has to stop. Handshaking as well. I know it's such a cultural thing we have. We have to stop that. Then we've got the goggles, the masks that the staff should wear. The use of antimicrobial mouthwash. You should kindly ask your patients to always use hydrogen peroxide, and then if you want, also chlorhexidine gel. Chlorhexidine mouth rinse. Also, this one is very important to me, aspiration. So we all know that there's a lot of procedures that you can just put the saliva ejector in the corner of the mouth and go ahead by your business by yourself doing that dental treatment. Now, I don't know about you, but in my practice, even our dental hygienists have an assistant. Why? So that the hygienist can actually have both hands free, one holding the mirror, one holding her instrument, so she can work effectively. If your second hand is using a aspirator, or the quality of the treatment isn't that well done, I believe. Moreover, if you are creating aerosols, like for a restoration or something like that, having an extra pair of hands help you with the aspiration is of invaluable importance. And I don't think a lot of people are thinking about that one. So we really do advocate, and I know it's an extra cost for the practice to have an extra pair of hands, but really reducing aerosols is of vital importance. You can also use technology such as lasers. Yesterday, we had an amazing conference from Light Instruments, and ERG-YAG lasers also reduce aerosols. So, of course, there's a lot of technology out there that can improve that, but we've all got to get back to work to provide for our families. And, we're not going to change that fast. But I think having somebody extra, even if you call in your receptionist, help me out here to reduce aerosols, very, very, very important. And then, of course, we're talking a little bit about air disinfectants. So there's a lot of things out there. You've got your UV lights. You've got propolis diffusers. The Klinkart Foundation is proposing that, so it's like not so chemical. You've also got air sanitizers. There's a lot of stuff out there. And of course, use them safely according to the manufacturer's recommendations. Moreover, we're talking about common areas. Your reception is going to change. No magazines, no books. You don't want people touching things. So eliminate all of that from your reception. No commands so people can touch. No self-coffee machine. So if somebody wants a coffee or a tea, you can serve it to them. Your furniture should be something that's easy to wash down. So no complex furniture. I'd like to thank Bartosz from that one from Poland. Thank you for that, my brother. Also, social distancing within the reception. If those receptions packed with patients, man, come on. And patients that bring their family members, again, stop. Unless you're handicapped or a minor or an elderly person and need assistance, don't bring your family to the dental clinic. Stay outside in the car. I know, I speak out of experience. Some people bring their entire family and wait in the waiting room. And I've always been very polite and let them stay. I think those days are over. What we're actually doing currently, these rules are for post-COVID, but what we're currently doing for emergencies is one patient in the clinic, and we have a large clinic, so we're seeing very, very few emergency patients. But we're telling them to stay downstairs in the car, and only when we call them do they come in. My team are completely shielded, gloves, everything. And then the second the patient comes in, we're asking them respectfully to wash their hands, their face, where we're putting on hand sanitizers. They wear a head mask, face mask, eyeglasses. They wear a surgical gown and gloves and shoe protectant. And that happens in the reception before they even go into the treatment room. And then, of course, the mouth rinsing. So you shouldn't be shy or to ask your patients to do these things. Moreover, so definitely not too many people in the common areas. Non-essential people should definitely stay outside. And I'm actually asking people to take a shower before they come to the clinic. We all have those patients that, come in full of dandruff and all of that. A lot of people aren't that hygienic. I think you should feel comfortable to refuse treatment to somebody who's not being hygienic. Also to wear simple clothing, not wear too much jewelry. If somebody's sweating, you can refuse treatment. Probably invest in one of those little handheld thermometers. If somebody's got a temperature, you can refuse treatment. And some good sense. So if people have runny noses or coughs, not to come to the clinic. And if you feel comfortable to do that, ask your patients to bring a valid COVID-19 test prior to treatment. But again, in the future, once immunity is out, I'm sure there'll be an immunity test that they can provide. And I hope that it's going to be many years before something else comes along. But I think much like I started with the HIV fear that I've had in me, the fear of something new coming along is going to be around for a very long time. So again, we've kept the concepts of slow dentistry incredibly simple. I'd also just like to give a little shout out to Nina Blattler. That's Nina on the left. Many of you don't know, but she's my sister. She has a huge background in education. She works at the University of Zurich, and she runs the business. I've got, I don't have time. I'm mostly doing my clinical work and my lecturing, and so she's the one that's put in all of the effort to bring this project to fruition. And also all of our honorary global ambassadors around the world that have given us so much valuable input. So again, if you want to download that document I was just doing, you can go to news, and it's free for anybody. Feel free to share it. Share it on your Instagram, on your Facebook, on your LinkedIn, hashtag Slow Dentistry, please. And sign up today because we really could use your support. So let's get back to just the rest of our conference here. So some other areas where slow dentistry can also be understood, or concepts where slow dentistry could be, let's say, expanded. And again, we're trying to keep it simple on just these 4 basic cornerstones, and we've explained that. But of course, there's other areas that we have explored and we will explore, but we want to consolidate slow dentistry as being these 4 simple cornerstones because the general public understand them. And very soon we will have different levels of slow dentistry for dentists that want to, go further and deeper into this. So for example, the time you spend acquiring data for a digital smile design, photographing, scanning a patient's mouth, CBCT, sending all of that information to the cloud, managing that, FaceTiming people, all of this, we consider that we can spend 30, 45 minutes, sometimes up to an hour behind the scenes acquiring data. But what does it allow? Better planning, better outcomes, less overtreatment, and less risk. And many times you can do all of this and the patient doesn't accept the treatment. So, that's one of the ways we see slow dentistry also being used in the future. But again, while we're going through the COVID outbreak, we really don't want to put too many messages out there. Our main message right now, till this outbreak is over, is going to be our clinics focus on a 10-minute disinfection protocol in between appointments. And that is going to be our gold standard. And not many clinics can do that. If they go back to business today, a lot of clinics in the world won't be able to do that. Their business plan just they can't afford it. So if you're charging, $30, $40 for a filling, the only way you're doing that is because you're seeing a lot of patients a day. So I really urge a lot of business practitioners and business owners out there to take your time right now to see how you can create a slow dentistry business plan for your practice, just with this one simple thing. I'm going to start using a rubber dam on all of my root canals and most of my direct restorations. Second, I'm going to do 10 minutes of disinfection in between appointments. I'm going to take extra care in cleaning my rooms, cleaning my office, so on and so forth. All of my patients, I'm going to have a signed valid consent for. And of course, I'm going to wait for anesthetic to take full effect when it's necessary. And if you're doing those 4 things, you can get this approval and you're on board, you're part of the global network. So getting back to other levels of complexity that we can talk about in the future, for example, teams behind the scenes discussing a clinical case. Sometimes with big cases at my clinic, we've got 4 or 5 doctors spending up to 2 hours discussing a clinical case. Why is this important? You get a better workflow, better synergy. You make less mistakes, and you get better case acceptance from the patient. These things are definitely also under the umbrella of slow dentistry. But again, We'll be talking about that later in the year once we've consolidated our 4 cornerstones and the global branding of Slow Dentistry, and keeping it super simple. Remember, we're communicating to the general public. We're giving the general public a place to go when they're choosing a clinic. Because if you think about it, today, when they're choosing a clinic, they want price, location, price, location, price, location. Good marketing. So, I think that now they're going to want hygiene first. They're going to want a clinic that's not going to make them sick from the other people in the clinic. And it's going to take, a lot of time for a lot of clinics to make that change. Those that have been doing it are definitely in a better position to survive post-COVID, the post-COVID world in dentistry. So I really urge those of you watching this to definitely change your business plan, reduce the amount of patients, even if that means raising your fee a little bit, and use this badge of Slow Dentistry, if you're on the global network, to protect the way that you explain this. So you can actually just send this to your patients saying, we're part of the Slow Dentistry Global Network. Please check out the website and understand we will have this ready for you when you come to the clinic. Watch your case acceptance go up, all right? So again, these are other things that we will be doing with Slow Dentistry in the future. So please feel free to download those 10 steps from the website, slowdentistry.com. Sign up today and help us make this a global movement. And if any of you are interested in, setting up, study clubs or so on and so forth, this is all about sharing right now. So feel free to direct message me, email me, get in touch with me on Instagram or on Facebook, or any one of our amazing ambassadors. So if you go to slowdentistry.com and check out honorary global ambassadors, feel free to click on their names and reach out to them as well. They're amazing dentists, and I really thank them for helping us believe in this already a couple of years ago already. So just to be clear and to have some proof here, as you can see here, the slowdentistry.com was registered in 4th of August 2010. All right, and we have a Slow Dentistry Global Network registered trademark for the European Union, and we've been doing this for quite a long time. We've been thinking about this for quite a long time, and there's some confusion about other slow dentistries. People can do whatever they want. This is what we're doing with it, and we've been thinking about this for a very long time, and it's all about improving the standards of care globally. So if you want to photograph this as well, this is a QR code that will take you to the website. And again, pretty simple, slowdentistry.com. We own that. It's ours, and it's yours if you want to join it. So it's time for you to think. What are you going to change in your practice to help protect your patients? It's no longer acceptable to do things in a rush. It's no longer acceptable to overflow your workload. It's no longer acceptable for you to be this guy and, pack your day full of things and think you can get away with it. The public is going to start asking very, very serious questions. Are you protecting me? And they're going to ask that before how much is the filling? What should happen? So I think it's a great time for you all to really start considering, change your business plans. And I know it's not going to be easy for a lot of you, but those of you that do it now are going to have a role in the future as leaders of your dental community. So I'd like to thank you for your time. Please feel free to join me on my Instagram at Dr. Miguel Stanley, or my Facebook, and Miguel Stanley. So also, if you go to miguelstanley.com, a webinar that I gave earlier this week, there's a lot of webinars out there. We've recorded them. You can rewatch these webinars. This current webinar is being recorded and will be up on my platform as well, and also made available on the slowdentistry.com platform. And I'll be giving some more webinars at the Miguel Stanley Academy, and I want to thank you all so much. Stay strong. Don't despair. All right? Wash your hands. Stay home. Help flatten the curve, and we'll get out of this. All right? Thank you all so much.